Pain, what they now call the fifth vital sign. Clearly pain is awful. I hate it. You hate it. But how do we treat it legitimately without causing more harm than good? First of all, pain medicines themselves can be dangerous. Every one of them has a potential side effect. Tylenol, probably the least side effects, but of course Tylenol is not a huge pain reliever. A little pain relief, not great. You don't have to worry about overdosing on Tylenol unless you take the whole bottle, and that isn't going to happen. So 2 Tylenol at any given time, almost with any other medicine, is pretty benign. But I'm not going to sit here and tell you that it's going to relieve all your pain. Aspirin, again, a pretty good pain reliever. It bears the problem of causing bleeding and when you take too much of it, and it can hurt your stomach. The same with other anti-inflammatories, what we call the non-steroidal anti-inflammatory drugs. However, the non-steroidal anti-inflammatory drugs, Motrin, ibuprofen, Advil, Aleve, Naproxen, Celebrex, Lodine, Voltaren, just to name a few, Mobic, all of those drugs operate the same modus operandi. They are anti-inflammatories. They decrease inflammation. And in that sense, they have 2 very important functions. One, the pain relief, but the second, the legitimate reduction of inflammation, which causes the pain. So if you really think about it, they are the best of the pain relievers. However, they also have side effects. In the elderly particularly, they can really mess with renal function. They can cause some difficulties with fluid retention as well. So by all means ask your physician. And of course there's always the potential for ulcer. Well, this gets a little bit confusing, but you're smart people, you can understand. And aspirin will make a platelet dysfunctional for the entire life of the platelet. And a platelet lives for 8 days. So we make 1/8 of our platelets every day. 1/8 of them die, and we make a new set of platelets. When you take a little bit of aspirin on a daily or every other day basis, you're affecting some of the platelets, not all of the platelets, but you are affecting some of them for their entire life, and they will not work as well. If you're dealing with another anti-inflammatory, any of the other anti-inflammatory drugs, they affect the platelet, but only for as long as the drug is in the system. Now, don't think that that's just for the 15 minutes after you take the medication, because these drugs do have half-lives, some of them longer than others. And so we generally say that over the course of about 4 or 5 days, the drug will be completely gone from the system if you've stopped taking it. So if you have a procedure that you're going to have and you're on an anti-inflammatory, you can still have the risk of bleeding from taking that anti-inflammatory even 2 or 3 days after you've stopped the drug. So you do have to be careful. That said, as a pain reliever, as an anti-inflammatory, they are the best at pain relief. Now then, the opiates. The opiates, you know them all: codeine, Vicodin, Norco, Percocet, you name your poison, OxyContin. They're wonderful at pain relief, but they have nothing to do with inflammation. They affect your mental capacity. They decrease your ability to urinate, your ability to defecate. I mean, older people in constipation, that can be worse than the pain. So you have to be very, very, very careful with these medications. I almost refuse to give them to my older patients because I think that it's an accident waiting to happen. I know that when patients go to emergency rooms, they're begging for pain relief, and the first thing they get an opiate. And then we wonder why the patient isn't talking well. Well, their mental status is impaired. You cannot take these drugs and drive. I think that for the elderly, again, if you're already having problems with your gait and you've taken an opiate so that you don't have a sense of balance, not a good thing. So I always err on the side of less opiates and more of the anti-inflammatories. That said, for those people who cannot sleep, who have terrible pain, lying at home in bed, the opiates can be tremendous relief. And finally, steroidals as anti-inflammatories. Steroids are, of course, the best anti-inflammatory. High-dose steroids can eliminate pain remarkably, particularly what we call radicular pain or nerve pain. They can be a wonderful relief. but if taken over a long period of time, they have their complications as well. So you have to be very, very careful with steroids. I don't have to mention, you've seen all the sports guys with their steroids blowing up like a balloon. They cause water retention. They really do incapacitate your inflammatory system to actually work as an anti-inflammatory, so they can increase the risk of infection. If you have tuberculosis or any long-term chronic illness, you should not take steroids. So there are a number of circumstances where you really shouldn't take them. This is one of those drugs that needs to be prescribed by a qualified physician, not a nurse practitioner, a physician. So ask your doctor what's best for your pain relief. But remember, if you want to relieve your pain, you might want to start with, why do I have it in the first place? Try to relieve the cause of the pain before you just mask it with opiates that have tremendous side effects.